What I see in Uganda is that the problem of prematurity is so big, but preterms are lost in the numbers. We know that 30% of all newborn babies who die in Uganda are actually preterms, but there has not been much attention to this problem. There is urgency for Uganda to scale up preterm care in Uganda in order to address the big problem of newborn survival and child survival in the country.
Today is exactly 1 month and 3 days since baby Dorothy was admitted at Uganda Hospital in eastern Uganda. All that time, her life has hung on a thread. Although Mom and Dad have been with her all this time, Dorothy has taken little notice of them. Dorothy was born preterm or prematurely. Born at 6 months at a village health center, Dorothy was referred here weighing under 1 kilo. Life has been a little unkind.
They refer us a baby when the baby is in a poor state. So at least if they are also motivated by giving them the skills and then the logistics to use, I feel we could improve.
When atuuka awo abasawo ne banfaako ne bamuteeka mu kyuma bakiyita incubator. Sibimanyi bulungi kale munansonyiwa. Naye ng'omusawo waliwo omusawo omu simumanyi linnya naye bambi afaayo nnyo, kazi muwanvu bw'ati muddugavu. Afaayo n'aceekinga naye eno bamuyita, abazaala bamuyita, buli wamu bamuyita. Ate nga olaba nga mu butuufu abasawo era batono.
She has required the support of an incubator, oxygen and expert hands to keep alive. Today, however, the mood in the nursery is different. Dorothy's skin has turned from pink to a dull yellowish color, and her breathing has halted. And that is a bad sign. Will frantic efforts to restore her breath endure? Dorothy's story epitomizes the plight of preterm babies and their parents in Uganda. Fiona held her baby for only 1 week. Although born too soon, at only 6 months preterm, the baby showed all signs that she would live.
It survived. The treatment was given to us every day and on time, in fact. But during those days, there were very many people who gave birth to prematures. We had only one machine. The incubator, it was only one. And it could at least afford only 3 babies, those prematures, to the maximum. Now, as days used to go on, they would ask for us who had at least stayed there for 2 days or 3 days to remove our babies so that those new ones should also be placed in the machine. And they taught us to put them on our chest, the kangaroo style.
Within 1 week, the baby had gained weight from 800 grams at birth to 1.3 kilos. To her, that was a vital sign that she would live.
Then it was the nurse who realized that the baby had changed. She asked me, "Hey, did you see the baby that she had changed that color?" I said, "No, I couldn't even realize her." Said, "Okay, hurry, we can put her in the incubator." The baby had changed from pink to brown. They untied it. She was not moving. They tried to Anyway, she had already gone.
Uganda Hospital, much like many health facilities in Uganda, has been receiving an increased number of preterm births. That comes with a number of challenges.
One other challenge which is not discussed as much is that the hospitals outside Kampala, we are never set up to care for newborns. These hospitals, we are made to refer newborn babies to Mulago Hospital, which has a neonatal care unit.
Newborns are perhaps the most vulnerable population the world over. Preterm or babies born too early, at less than 37 weeks gestation, are particularly at risk. Currently, prematurity is the leading cause of death among children under 5 around the world. It accounts for 35% of all neonatal deaths and is a leading cause of disability and ill health later in life. Uganda is the 28th country worldwide with the highest preterm birth rates, estimated at 13.6 per 1,000 live births.
We've tended to prioritize HIV, AIDS, malaria and TB. We know they are important, but actually currently right now, more babies die in Uganda than the number of people who die from HIV, AIDS. Also more babies die in Uganda than the number of babies who die from malaria or TB. But the attention has not shifted to interventions, especially in the newborn health.
The challenges are many. A routine visit to hospitals in eastern Uganda found that the facilities suffer constant stockouts of vital life-saving commodities that affect the survival of newborns. The proper use of those commodities has also been identified as an issue.
Some anecdotal data shows that there is a gap in the skills of the service provider, the prescriber. And that means you won't even notice that I don't have this because you don't know how to use it. You have never used it. And maybe you're even frightened because the nature of training has not taken you through this.
So this is a major problem. We have infrastructure problems, we have personnel problems in terms of numbers, types of cadre, in terms of their training, in terms of their supervision, in terms of their motivation, in terms of their support.
A preterm birth leaves a lot of victims in its path. The parents, the health facility, the family, the community, and indeed the government, they all suffer in their own way. Without a social support system, it's double tragedy for them. And where a teenager is involved, it would be hard to recover from the impact of a preterm birth.
They become pregnant and drop out of school. Then after they've dropped out of school, they are chased away by their parents to start staying with the husbands who in the first place may not even want to stay with them, or they have other partners already. And then after being chased away by their parents, then they give birth to preterm babies.
That is exactly what happened to Shamim. She was a teenager in Form 3 when she got pregnant. The problems that followed have left her helpless. First, it was a difficult pregnancy for her. She was in and out of hospital for the entire 6 months of her pregnancy. Her parents sent her away from home, and she was forced into an early marriage.
Newangobye waka kinogenda. Tata yanyiga nnyo kuba yali antaddemu ssente ze. Nangamba genda n'omwami we. Ne tugenda. Ne tubeerawo. Just a few months. Mami natandika okyankalana.
She dropped out of school, hoping that she would rejoin after birth. Her baby came too soon.
nga mutini nnyo bwe wamupimamu ng'ataweza na kiro katumayi ne kagwere ku luveera we kati nga katini.
Lots of things changed following the birth of her baby. First, she was in hospital for a long time.
Nga bunaku tulina okugenda mu ddwaliro nga mama yakwata ssente n'ampa mwene yabivaako ali kumukwala omuwala omulala.
So even when they are discharged, they find it a problem to find money to come back to the health facility for follow-up of their babies.
Atumala tawamusenyiga mu kaseera aba alwala.
The special care unit at Ginger Referral Hospital is a tale of hope. Headed by Dr. Harriet Nambuya, the special care unit cares for newborn babies who are either born preterm or babies born and have complications. The unit admits about 70 to 200 babies a month. The unit is a special initiative. It demonstrates that preterm babies can be prioritized and that they can survive and thrive.
Even within our resource limited constraints, there are success stories of babies that we have seen. Because in this unit, I think the lowest baby who has survived here is about 600 grams. And we are proud of that and we are happy of that. And the babies are alive, they are twins. One was 600, another one was 700 grams. And we are happy that the babies are growing normally and they'll gain to their full potential like all other Ugandan children.
Research shows that actually doing kangaroo mother care is more effective than using incubators. So for the majority of the babies that are born in even rural areas, if brought to a hospital where there are trained health workers, then most of these babies could be saved.
Most important, the unit has a follow-up clinic. Every Friday, mothers with preterm babies come for review.
You may be very happy, excited, the baby is doing well, you send it to the community, but while in the community, the complications worsen and baby dies there. So when she comes on that day in the review clinic, what do? We want to weigh this baby to see whether the baby is gaining weight. 2, we want to check on the growth of the baby. So we usually do what we call head circumference of the baby. So, and all that helps us to see whether this child is growing normally.
This follow-up should also be extended to the community level because a number of mothers fail to come back in these clinics. So at health facilities, the health workers need to identify who are the babies that have not turned up in those clinics and then followed up at community level.
A lot of professionals have to get interested in the newborn. And this, so the OBs-GYN, the pediatricians, the midwives must convene on one table. What is the quality of that neonatal care? Are you even able to detect? Do the mothers know what conditions to avoid? So data, the health facility. Skills and proficiencies of health workers to show that we've been needing this over the last so many, but where's the problem? An investigative process which is going to help service provision.
Preterm Birth Initiative East Africa is another ray of hope.
In this study, which we call the Preterm Birth Initiative, and the work is being done in Uganda, in Kenya, and in Rwanda, basically as a demonstration project of what can be done within our health systems to save babies, especially preterm babies.
So in our project, we'll focus on the intrapartum and immediate postnatal space, which will be the time when the women are at the hospital and are getting all the care that they can get to make sure that that care is as good as possible, and that when the babies come, that they're identified as babies who need extra help and they're given that help, and that they actually get the help they need soon after birth.
We're also going to be engaging national. So whatever we learn in these hospitals, we want to disseminate to the Ministry of Health and to other partners so that the lessons learned are quickly taken into informing programs for implementation, so that national level scale up of better care for babies, especially preterm babies, is done.
And I think together, working together with the hospitals and the staff, we can further improve practice and further strengthen what they're doing, both in terms of clinical practice and even just tracking and data capture.
I would just pledge that Parliament will continue to support maternal health, and that we count on us to do what is necessary to improve the lives of our children, including especially those who are born preterm. And we shall be guided by the research that's coming out of this program. So let us unite to end these preventable deaths.
Taking care of small babies is an essential investment in both the short and long term. A safe and healthy start in life is at the heart of human capital and economic progress in every country. As government leaders, civil society organizations, health workers, families, communities and other partners come together to enact change, we can prevent babies from being born too early and too small, and ensure that small babies get the critical life-saving care and nurturing they need.